We are going to talk about the connection between our thoughts and the brain and symptoms. And we will focus mainly on pain, but not just that. And it is in many ways what we're going to talk about today is very personal to me as well, as we will find out together very shortly. What I'm going to talk about is intertwined with my own personal story. So it has a very profound, very deep personal touch to it. So I would actually like to begin with telling you about my personal journey with symptoms that originate from our brain, originate from our mind, and affect our body. And as you can see, the headline is TMS, which is a phrase that refers to tension myoneural syndrome. Just to explain what the words mean. Tension, we all know, right? Tension is tension. We can all know when we feel tension. And there are a few causes for tension, a few origins, which we will also narrate today. Myoneural, myo means in Latin muscle tissue. Neural means in Latin nerve tissue. And syndrome in the medical language, it means a phenomena that affects not just one part of the body, but many parts at once. That's a very general definition of syndrome. Okay, so tension myoneural syndrome means a phenomena that could affect many parts of our body, that originates from stress and affects mainly muscles and nerves. Okay, that's the definition of it. I would just like to emphasize it does not replace a proper medical diagnosis, what we're going to talk about. On the contrary, it even emphasizes the importance of a proper, thorough medical diagnosis. So let us do a short show of hands. We've done that already before. How many of you suffer now from pain at the moment? Okay. How many of you have ever suffered pain that was more than just like 1-2 days? Okay, it's basically all of us. I can also raise my hand. So we all know what pain means, and what we're going to talk about is understand how exactly, or more accurately, it's generated in our body. So first of all, that's my personal story in pictures. That's the illustration of it. And about 4 years ago, a bit more than that, I began suffering from back pain that was radiating to my left leg. And I actually remember the exact moment in which it began. I felt a very dull pain in my lower back on the left side. And then I told myself, okay, that's the pain you already know. I've known such pain. It used to happen twice or thrice a year. It used to persevere for about 1 to 2 weeks, and then it was over and I was back to life. But after a while, I was feeling that the pain is beginning to radiate to my leg. And since I know what is written in medical literature, I immediately assumed that it's a bulging disc or a herniated disc in my vertebrae, in my back. And by the time we were together, I was together with Tamar, my wife, And by the time we got back home, I was literally unable to move. So it was already hard to climb up the stairs. It was already hard to move freely and to function as regularly, as usual. And that episode actually began a period in my life that was very, very, very hard. It was pain-ridden, and it lasted for 10 months. So for 10 months, I was actually living in pain. And sometimes it was weaker, sometimes it was stronger, but it was always there to a substantial amount. And those actually are the things that I've tried. I tried the corset, the back corset, this thing. And this is a TENS machine. It gives electrical pulses. And I used to put it twice or 3 times a day on my back and on my leg and in all sorts of places where I could feel the pain. I changed my chair to an ergonomic one. It's more comfortable. That's for true. I still have it. And I tried all those exercises for the back. I used to lie on my back and raise my legs and tilt them from side to side. Maybe you've tried those also. And I've taken pills, of course, anti-inflammatories, shots to the back with steroids, which supposed to help. I did reflexology. I did osteopathy, chiropractic, of course, physiotherapy, and I went swimming. Why? Because when you have back pain, then you would be recommended probably that you need to go swimming. None of it helped. Everything helped moderately, but then immediately thereafter the pain came back. And after 10 months, I was like more or less stable. I got to a point in which the pain was not so severe and I was more or less stable. I couldn't yet lift heavy objects because even trying to do that would immediately mean a burst of pain, very intense pain. And we went to a water park and I said, okay, I'll try doing one slide, one turn. And because I was feeling more or less okay and I wouldn't allow myself to do such things for almost a year. After doing that, I've had a very, very intense attack, which actually brought me back to the point in which it all started. The pain was intense again. I was again in bed. I knew that it should take me at least 1 to 2 weeks to just be able to get out of bed until the pain reduces a little bit. But then I said, okay, if after 10 months of pain and all those treatments, trying to use all those methods, I'm back in the beginning point, then something here is wrong. I wasn't able to cure myself, and maybe the diagnosis was not right. Maybe I'm missing something. And then with the help of Tamar, again, who searched for a solution on the internet, she found a blog post of a woman that suffered from symptoms that were more or less similar to mine. And this woman was reporting that she became, she healed through reading a book that was written by an American doctor, Dr. John Sarno. So we have Amazon, and we ordered the book. I was lying in bed. I literally couldn't do anything else, and I started reading the book. And so I was lying in bed, and the book, just like that. And as I was reading through the book, I was feeling that I'm beginning to be better. And after maybe 2 to 3 days reading into the book, I was feeling 70% better. So I could actually go out of bed and start walking around in the house. And the other family members were looking at me half in worry, half in surprise. What are you doing? are you sure you can do it only after 2 to 3 days? Shouldn't it take you 1 to 2 weeks? And then I said, no, it's okay. I'm beginning to feel better. And after a few more days, my condition continued improving. And after three weeks from reading the book, I was already out jogging in a very light manner. Like not intensely, but very lightly for 5 minutes. And after 1 month from beginning to reading in the book, I could lift already a suitcase which was 20 kilos with hardly no pain at all. So one may say, if one hears such a story, one may say it's a miracle cure. Indeed, for me and for all the people that knew my condition, it was a kind of a miracle because I was considering myself as crippled. Many things I couldn't do. Trying to lift a shopping bag that was more than 1 kilogram would mean immediate bursts of pain, immediate bouts of pain. And suddenly I can move around freely, I can lift heavy things, I can walk freely, and I can do basically everything that I want to do. So what was going on in here? If you've been having pain, if you've been experiencing pain, then you might know that suffering from pain, by the way, many other symptoms, might lead you to some low points. For instance, my low point was after many months of suffering from pain, trying to get out of the house, just in order to just walk around the block and breathe a little fresh air. And as I was going outside, I was starting to leave the house, but then after 10 steps, I could feel an intense pain in the back radiating down the leg. And then going back to the house, which is only a few meters walk and 15 stairs, took me 1/4 of an hour. So because I needed to do that like literally step by step and resting between the steps in order to relax the nervous system and the pain reactions. So if you've had pain, you know those conditions. The book was this book, Healing Back Pain by Dr. John Sarno. And by the way, this book is also translated to German. If you'd like the reference, it's called Befreit von Rückenschmerzen. I could send it later on. And what Dr. Sarno claimed in the book, he was actually narrating his experience treating pain sufferers for a few decades. So he was a very, very experienced doctor, a very, very experienced physician. And what he was claiming is that contrary to the common notion that chronic pain is caused by structural changes, what actually causes chronic pain are subconscious emotions, tension. And while reading through the book, I could see how correct he was, how true his insights are. So we of course, we would get deeper and deeper into that subject the more we delve into our meeting today. So what he claimed was that our emotions and tensions are actually causing pain at the first place. And what perpetuates pain is no other than our thoughts and concepts. Okay, so just remember that. Emotions, subconscious emotions can trigger pain. Real, genuine physical pain. And thoughts and concepts and fears that arise from those concepts can and will perpetuate pain. So let us just go deeper into the subject. I hope this is clear enough. What we can see here is it's a working boot, and you see this like black thing that's going through it. That's a nail. That's a 15 centimeter nail, 15 centimeter long nail. And what we're actually seeing is a nail that's penetrating from below this boot, this working boot. And that's a story of an English construction worker that jumped on a nail. And the nail pierced the shoe from bottom up. And this young worker came to the emergency room and was given very strong pain medications. And he was given alongside with those pain medications, he was given sedatives, like medications that make you like half asleep, because the pain was so intense and he was in such agony. After a few hours, like every attempt to try and pull out the nail caused him immense suffering. And after a few hours and a few doses of those strong medications, the team in the emergency room managed to pull out the nail, and the man took out the shoe and the sock, and what was shown was a miracle cure. He wasn't even scratched. The nail went through in between his fingers, like, more or less like that. And there was no scratch, even not a scratch on his skin. So the question arises, where did the pain come from? Okay, so that's an extreme and intense example. And this picture was published in the British Medical Journal, the BMJ, British Medical Journal, at the 90s. I don't know if you remember, but we had in Germany last October a storm that was called Javier or Xavier. It was a European hurricane. You remember those days? I remember going out, and the wind was so strong that like it blew trees and it broke branches, and everything looked like chaos in the streets. And after the storm passed, I went out to one of the lakes and took a few pictures. And those here are trees that were uprooted. This root is my size, is my height. It's very, very big. And branches were broken, and you could see like tilted trees that fell over cars and houses and everything. And when we think about pain, this is what we have in mind, right? When you feel pain in the body, what's the first association that comes into mind?
Something is wrong.
Something is wrong, right? Something in the structure is either broken, dislocated, fractured, injured, etc. That's the first association that we would have when we experience pain. When we experience pain in the back, for instance, then we think that something in the back is broken, that our back is giving way. But is that fear justified? If you have, let me do a quick survey. If one has a back problem, how one should lift things? What's the proper way of lifting things if you have a back problem?
With your legs.
With your legs, okay, right. So, for instance, if I would like, if this thing is on the floor and I would like to pick it up, then how should I pick it? I should bend, right? with my knees and pick it like that. That's the proper way of lifting objects if you have a back problem. For instance, just for instance, for the example. But why shouldn't I pick it just like that? It's just a little thing, right? A little object. I'm not weightlifting now 200 kilogram weights. And by the way, this is an MRI image, one of the MRI images that I myself took when I had the episode of pain. And I don't know if you can see here something black that is protruding backwards. That's a herniated disc. If you look at it from a different angle, you would see the herniation. You would actually see that. And that's a herniated disc between the vertebrae in the body that is called L5 and S1, a very common place in which discs tend to bulge or herniate or rupture. I still have this herniated disc in my back. The thing is that if you look closer, it's not evident from here, from looking at this picture, but it's evident from other pictures that I have with me. The disc is protruding to the right side, and the leg that I felt the radiating pain was on the left side. So it's not really the reason for the pain, right? Because if it would have been the structure, then one would suppose or one would think it should be radiating to the right side. But it didn't. So we have a discrepancy here. Something doesn't fit. And those bulges of discs, if we look at the back, are more so often accused as culprits, as the culprits of what causes pain. But mostly they are not the reason for the pain we feel in the body. We are so afraid of structural changes when it comes to pain. But is this fear justified? And just to recap on that, also back in the 90s, a very interesting research was published in the most important medical journal in the world, which is called the New England Journal of Medicine. It's the most prestigious, most known medical journal that we have in the field of medicine. And this study that was done by Maureen Jensen and colleagues was testing a very interesting, a very intriguing hypothesis. What they wanted to see is what happens if we take people that do not suffer from pain, no symptoms at all, and we put them through an MRI examination of their backs. Okay, so symptom-free people are now examined by MRI. And what they've shown, they took some 100 people and did those MRI scans, and those scans were interpreted by specialists in radiology, the specialists that learn how to read those images. And what they've shown is that some 2/3 of normal, healthy, pain-free adults would have some kind of a bulging disc or structural change or even herniated discs in their backs. 2/3 of pain-free subjects, pain-free people. So let us just for a minute take a more reasonable stance and be ourselves scientists. If we were the scientists that took the results of this research, what would have been our conclusions? What do you say?
whatever the bulging disc was, that injury.
So what does it actually mean?
Most likely that it's not the source.
Yeah, so if we have such a high prevalence, so many people are having those changes in their structures without pain, it means that it's more normal than we think, or we might have thought. And of course, this, by the way, this research was published, it was done in the US, and it was published in the New England Journal of Medicine. Then it hit the news because it was so groundbreaking and so surprising. The results were so intriguing and so different than what we thought. And of course, afterwards came many other researchers that tried to see, okay, is it just a fluke? Is it something that happened accidentally, or are we onto something here which might be very important for us? And many researches have been done through the years. And 4 years ago, a very big research that is called meta-analysis. Meta-analysis are huge investigations of the medical literature. What researchers do is they take all the researches, the high quality researches that were done on a specific field, and summarize them. And when such researches are being published, many times they influence the field in which they are published. Okay, so it's like really high quality researchers summarizing a theme in a specific field. So this research was summarizing all the high quality examinations that were done on healthy people, which undergone MRI scans. Okay, and this is what they found. That's a short summary. So just try to find yourself. This is the age. That's the age group from 20 to 80. Try to find yourselves in this scheme. And those are changes that we see in those scans. So if, for instance, you are 40, or let's take 40, what are the chances that you're going to have a disc degeneration? 70%. Think of the word degeneration. What emotional quality does it have to it? Fear, right? We were talking about thoughts, concepts that cause symptoms, just to connect us to the main topic of today. So, degeneration is a frightful word. Imagine what would happen to you if you enter a doctor's office and the doctor looks at your results and tells you in a severe look, you have degeneration. What would it cause you to think? Maybe the doctor had a severe look just before it was just before a lunch break, and the stomach was already beginning to show signs of hunger. This could also be, but it's the interpretation that would cause a reaction that is an inner reaction that would influence the thoughts. Because if you're degenerating, some part of you is degenerating, it means you're in trouble. And that has a lot to do with the true organism that is responsible of creating pain, which is our brain. We'll recap on that a bit later. So if you have a herniation, let's look at herniation, and you're 40, then 33% of healthy, pain-free adults would have a disc herniation, like I do, for instance. Okay? What about spondylolisthesis? That's a very long word in Latin which is used many times in interpretation of MRIs, CTs, and etc. It means the more common word is sliding of a vertebrae. Okay, so this sliding, just think, if you have this diagnosis, it means that a part in your body is sliding. What does it mean? Where is it going? It's like tectonic movements inside somewhere in your body. It's very frightening. But see what happens to it as we age. From 3% at 20 to 5 to 8 to 14, 23, 35, and 50 by the time we are 80. By the way, those numbers are rounded. They're not the exact numbers. I just put them here like that for the illustrative purpose. The numbers in the research were more accurate than those. But just see what happens to us as we age. What is going on? We change, right? We change with the age. One can see that when we look at the outside, our faces change. We have more wrinkles. Our stature stoops with time, so we lose a bit of height. Those changes are visible, as well as those changes that are visible. So it's not those changes, in most cases, that cause pain. As we said, it's the brain. Other things that don't cause pain. Sitting won't cause you pain. It's a common notion, right? That if you sit too much, it will generate pain. But it doesn't. It's been researched. It's not so healthy to sit, as we talked in previous lessons. But it's not going to cause you in itself pain. Unless you sit hours on hours and hours without moving yourself, then your joints would cry out for some movements, because our joints really love to move. Okay? When you fall in your childhood, it won't create pain after 20 years. Many people come, I'm saying it because I hear the descriptions. Many people come and they have pain, and they hear from all sorts of therapists that their pain in the ankle is because they fell on that ankle or sprained that ankle 20, 30, 40 years ago. Not true. Cannot happen. So an accident in the past is also, you cannot have an accident and be 10 years pain-free and then have pain after 10 years, which is caused by that accident. Those are all descriptions that I hear. Cannot happen unless something else is causing that. It's not the accident. Whiplash. That's a very striking example, because in countries, for instance in East Europe, where whiplash is not reimbursed by insurance companies, then you don't have long-term whiplash effects. You just don't have them. Whereas in countries where it is reimbursed, you would get many people that suffer from neck pain due to a big whiplash that happened months and sometimes years ago. What about crackling sounds from joints? You know those ones?
Yeah.
Which are very frightening, right? If you bend yourself and hear a crackling sound from your back, what would you think at that moment? It's like a broken branch, right? Something is broken, something is dislocated. You've hurt yourself. But actually what we understand today, and that also has been researched, is that those crackling sounds are actually gas that's moving inside a joint, which is a healthy phenomena. It's good that it happens, actually. So if you know that, next time you bend over and hear this noise, don't tell yourself, "Oh no, I've hurt my back." Tell yourself, "Oh, my joints are healthy." That's a good thing. So we talked about lifting technique, and unless you're an Olympic level weightlifter, you wouldn't need bending with your knees in order to lift things. You can lift them in any angle, almost any angle you would like. It's so long as you can lift them. Because if it's too heavy, then you would need some more power, and then you can use your legs. Past surgery. People that have gone, for instance, I've seen people that have gone in the past, for instance, an ankle surgery because of a fracture. And nails were inserted and it was all fixed like that through a surgery. And then many years, suddenly pain comes at the same spot, at the same location. Most of the time, it will not be connected to the surgery. It will be connected to something else. We are approaching that. We're nearly there. Old age. Getting older doesn't make you suffer from pain. So many people say, oh, it's because of the age that we're feeling this pain or that pain. Actually, what we know from research is that the more you age, the less you feel pain. That's the research. Those are the facts. Bad spine genetics. I have a bad spine, in my family I have a bad spine. I personally have that. It's not really bad spine, it's just what we're going to learn. My father and my sister are suffering from their backs. And many more. We're just narrating a few. So what does cause chronic pain? What does cause that? And the word chronic is very important. And we should stress also that in the absence of a diagnosed medical condition, for instance, if you have a systemic whole body inflammatory process, then it's kind of a different process that's going on. If you have a fracture, if you have a tumor, then other causes would cause pain. But in other conditions, what causes pain is actually emotions. And there is compelling research that shows the connection between emotions. Emotions can cause pain. Tension can cause pain. And as we said, thoughts, concepts, perceptions, fears would perpetuate it, would make it chronic. So workers that do not feel appreciated for their work tend to have 3.5 more times back pain. Anxiety, that was tested in 4,000 Japanese workers. When people suffer from anxiety, they have 4 times more back pain, 4 times more pain. It's not because they have some structural abnormalities, it's because the tension that they're feeling. Social rejection, do you know those times, maybe you can remember those times when the friends in the classroom, when you were a child, were playing and you were left out? Can you remember such instances? Being rejected, not being wanted, then it appears to cause more pain. Being rejected socially triggers pain pathways in our brain. Separation. When we separate, we feel pain, right? And it also has been researched and shown that the pain of separation is a real pain. It's a pain that we feel in our bodies. Also, not expressing emotions. If you hold your anger, for instance, you feel angry, but you wouldn't express it, you would feel more pain, you would have more pain. And being unaware of emotions would increase the chances up to 4 times more that you would have back pain. It also has this complicated name. It's called alexithymia. So I would like to stop for a moment now and see if there are questions or maybe sharings about what we talked until now. Yes, Andy.
In the study you talked about before where they tested the healthy, normal people with back
Yeah.
pain,
Yeah.
did they tell the people after the study what kind of trauma or what kind of injury their back had? And if they did those people start to suffer pain?
That's a very interesting question. I would answer with an example.
Okay.
I don't think that they told them because it wasn't the purpose of the study. But I've once seen a young person in the clinic. He was 20 something, and he was entering barely. He barely could walk, and it was very hard for him to sit, and he was really disabled, and he was very young, like 28, 27, 28, something like that. And then I asked him a few questions, and I always ask those questions, and I asked him, when did your deterioration start? And he told me that his deterioration started, like I tried to really pin that very accurately, and he told me that it started after he went to visit an orthopedic surgeon that looked at his MRI and told him that he had a severe spinal stenosis, a severe narrowing of his spinal canal where the spinal cord is traversing. And afterwards, his deterioration began. He actually lived very crippled. He had a very, very hard time. And then I didn't look at his MRI yet. I did a physical examination, an orthopedic neurologic physical examination, and I tested the strength in his muscles, and I tested the function of his nerves, and I tested his general condition, and he was a completely healthy young man. There were no signs of abnormality whatsoever. And then I took a look at his MRI, and I saw what was described. He did have a variation that seemed kind of not okay, but he was okay, completely. And then I told him, to his great surprise, I told him, you know, you're maybe one of the healthiest persons I've examined and met lately. And he was so shocked and so surprised that it took him a while to ingest that. And after a while, and I didn't hear from him for a few weeks, and after a while, he really loved playing soccer. And I told him, yeah, I told him, if you'd like, you can go back and play football. You can go back and play soccer. And after a few weeks in which I didn't hear from him, he wrote me that he was feeling much better. And he was able to do much more things. And he was much relieved from his pain. So what was going on in here? What was creating, think of it, what was creating his symptoms? It was his, I write it down here, it was his perception of his condition. It's the perception. It wasn't his MRI findings, not at all. It was the way he thought about his condition. And what was happening is that his perceptions of the severity of his condition, and try to reflect on that as we talk, as we speak about the subject. Try to reflect on that if you have if you're suffering from pain or other problems, by the way. What would the perception of the condition might do to the condition itself?
Enhance it.
Sorry?
Enhance it, make it more.
More than enhance it. Enhance it is correct, that's true. It would make it would make it more severe.
Yeah.
But in some cases, if not all the cases, it would be a major contributor to the condition itself. It's really important to understand that. Remember the worker that fell on this nail, 15 centimeter long nail? What was creating his symptoms? His perception of the condition. The nail didn't even scratch him. It's the perception of the condition. How long during one's life can one maintain a specific perception of a condition? How long could it last?
Probably your entire life.
Lifelong. Lifelong. It means that what is going on in our brain, our perceptions and thoughts about what we're having, could be, in quite a few cases, the reason for the chronicity of our condition. That's a very delicate point, and it's really important to understand that. And what I'm saying is based on research. It's not like what we would like to think. It's not wishful thinking. We now know that. We have precise scientific tools to measure that. And there have been actually very elegant research is done on the subject. So it's our perceptions, thoughts, ideas that cause symptoms. Yes? So what did Dr. Sarno say? He said that emotions that are subconscious, we talked about it, actually we had a few lessons about it. The last two meetings were about subconscious emotions and the way emotions interfere with bodily functions and systems and how they create symptoms. So what he said is kind of familiar to us by now. He said that emotions that are suppressed, like anger or others, create tension in us. And imagine what happens when we are suppressing and suppressing and suppressing and suppressing. Something is building in our subconscious. And when this tension is building in the subconscious, we will begin to feel it overflowing. We will begin to feel tension, actual tension in our daily lives. And imagine that it's constantly feeling, because we cannot help it without emotions. We have to feel all the time. We have emotions all the time. What would happen when the emotions threaten to overflow and overwhelm us? Then a defense mechanism is needed. A diversion is needed. And in that exact instance, the brain would generate pain. Not just pain, by the way. Sometimes it would generate allergy. Sometimes it would generate stomach problems. Sometimes it would generate a headache, migraine. And sometimes it would just generate having difficulties going to sleep, insomnia. So it could be, by the way, it could be generated by daily pressures. We all live in a very intense environment, Western kind of life, Western lifestyle. It's very pressured, it's very tense. We have to be on time, we have to do our best and achieve, etc., etc., etc. And especially if you're what Dr. Sarno called the perfectionist Buddhist. If it's very important for you to do things in a perfect way, and if you would like to be good to others, then it would create a structure that builds also inner tension, because you want everything to be very, very, very good, so you cannot really rest. And you want to do good to others, so you always have to be at work, yielding to others' needs. This would tend to create a lot of tension. And when the tension threatens to overflow, then comes pain. And that is generated by the brain. Sorry, the other way around. So we see the pain here and here. Here is the true story of pain. We are now entering the true story of pain. And that is a sentence said by Professor Lorimer Moseley, an Australian professor from the University of South Australia, that investigates the subject of pain and investigates the role of the brain in pain. And what he says is that 100 of our pain is created by the brain. 100% of pain is created in our brain. Does it mean that if you've had pain, you may have heard that it's all in your head? Half true. Because what is generated in the brain affects all the body and is felt throughout the body. So there's no pain that is just in your head. All pain is physical, all pain is real. So what does it mean 100% of our pain is created by the brain or in the brain? So first of all, we have sensory input, what we feel, what we're feeling. Can you feel the place on which you sit right now? Can you feel? Could you feel it a second ago before I asked that? No. Right? The brain feels a lot of things all the time. Input is coming all the time, but the brain has to decide moment to moment, second to second, what is important, what is not. When the brain doesn't consider, the brain, what I mean is our defense systems, doesn't consider something as important, then we wouldn't feel it. But when the brain decides that something is important, then we would feel it, and we would feel it very much amplified. So if you would focus on the place on which you sit, for 10 minutes this place would start feeling uncomfortable because the attention is there. So we are beginning with sensory input, and then emotions, tension, would join the equation. So when we're feeling tension, that's another reason for the brain to create symptoms. Pain, as we said, allergy, irritable bowel syndrome, peptic ulcers, headaches, troubles going to sleep, anxiety, etc. And then come fears. If we have a perception that something, a thought, that something is dangerous to us, what would we like to do? For instance, to run away. I could read your lips. Right, we could run away. And if we cannot run away, what would we try to do? We will try to avoid it, right? So if you have, for instance, back pain, and you are told that sitting is bad for you, what would this cause? Fear. What would the fear cause? Pain. That's a learned response. It is not triggered by you moving your spine. It is triggered by you activating your brain, which is in alert to defend you. And if you have an idea, a perception, a concept that sitting is bad to you, bad for you, then you would try to avoid it. And the way your brain does it is by generating pain. If you would hear that lifting is bad for you, then your way to avoid it, or your brain's way to avoid it, it's a subconscious process, would be to generate pain when you start lifting something. So the attitude that we have as a person would also be a part of this network. That's a network, that's a neural network that is actually a part of our brain. What does it mean, our attitude? Some people are inclined to pity themselves. Maybe you know those sentences, I will sit here alone in the dark, in the cold. You go and have fun. You know those attitudes? So that's an attitude. And actually this attitude, it's been researched, will cause more symptoms. it will cause people suffer from more pain than people that will have a more positive outlook on things. So the attitude is very, very important. Also in pain, but in many, many other symptoms. Conditioning and thoughts. Here I would like to emphasize a point about the way our brain works. Our brain, maybe you've probably heard about Pavlov, the Russian physiologist, who discovered that if you augment a sound with serving dogs their food, then after a while it's enough to ring the bell in order for the dogs to salivate. And that's a conditioning. That's a basic conditioning, but it's not just applicable to dogs. We also tend to learn in that way. So, if you have pain, for instance, you try to open a window, and at the same instance, you've heard a crackling sound from your back, which we know now that is what? Good, healthy joint, gas traveling through a joint, which is happy and healthy, but you didn't know that back then. So you were opening a window, and you've heard that sound. What would be the conclusion that your brain would conclude?
But this way, opening the window is bad.
Opening the window is bad, right. While I was opening this window, I hurt my back. Then maybe I need to not open windows, right? That's the conclusion. That's going to be the conclusion. So then you find yourself ending up being afraid of opening windows for the rest of your life. Do you have those connections? Can you find those in your own conditions? Don't walk in this or that area, don't do this or that action. Probably you can. If you look in detail, you will probably find them. But those are the kind of generalized conclusions that our brain makes. And as we can see, it's a part of this neural network that's responsible on creating symptoms. So what's the true cause of pain, chronic pain, in most cases? The true cause is that circle. It's the sensory input combined with emotions and tension, combined with fears that are based on our perceptions, which many times are wrong, combined with our attitude, who we are as a person, combined with our conditioning and our thoughts. By the way, just another word about conditioning and thoughts. If we as society think that pain is caused by structural changes, what would we as society think is good to do or good to avoid? So if it comes from structural changes, then if you have pain, you shouldn't, for instance, run. You should swim. Those are the things we already said. You shouldn't lift things, right? You shouldn't move your body in specific ways. You maybe should avoid sitting or buying an ergonomic chair, and many other things. So we get many advices that are actually based on the wrong understanding. Okay? So we have an idea about the problem of pain in this instance, that is not so correct as we see. And that's the new understanding. And just see how much of it is the body itself. It's the input part, right? All the other parts are happening in our mind. And today we are focusing on the thoughts. See how much of it is thoughts. All those three here are thoughts, in essence. So as we said, when we talk about pain, but it's not just pain, it's also allergies, headaches. Headache is a pain, but in the head, of course. Irritable bowel syndrome, ulcers in the stomach, anxiety, sleeping disorders. They are all generated by the brain, or at least the brain has a major part in their creation and maintenance and maintaining them. So we have to remember that, as we said, every pain is real when we talk about pain. Every pain is physical, and what is most important is what we know about our brain. We know that our brain can change. And look at this equation. If symptoms are generated by the brain, and the brain can change itself, what does it mean about the symptoms? The symptoms can change themselves because they are created by the brain. If symptoms are created by our perceptions and thoughts are things that we can work on, we can change. It means that we can change what is going on also in our bodies.